from 40. So they're written on the paper, not in that order. So I'm gonna start with the lateral. So lateral is gonna be done at 72. Why would lateral? Why would it be done at 72?
Magnification.
OID. So put your left shoulder up against the board for me. Look how far her neck is from the board. So to compensate, we'll talk about that. Track 28.9, compensate for that. We do 72. So it's called the lateral, also called the Grandy method. So place the patient in lateral position, shoulder resting against the IR, center at the level of the fourth cervical vertebra, center of the patient so that the coronal plane passes through the mastoid process. Is at the midline of the cassette. Talk about that. Shoulder touching. Make sure the shoulder's in the same transverse plane. Depress the shoulders as much as possible. Elevate the chin slightly. I do want to mention, this is the only other one. It says immobilize the shoulders by attaching one small weight to the wrist. I don't do this. Some clinical sites might do this. We did the weights for the AC joints. Some people do put the weights on the wrist to bring their shoulders down so you can see all the spine. I don't do it, but you might see that done in clinicals. I won't make you do that in lab, but just know that that can be done. What breathing do you think is going to be done for this one, though?
Expiration?
Expiration to get those shoulders down. Expose. So on this one, I already have it. 10 by 10 on the spine is going to be 10 by 12. C spine is going to be 10 by 12 lengthwise. Spine is long. I got your things drawn here. So it's going to be at C4. She doesn't have an Adam's apple, but where her Adam's apple would be, so what my centering on you is like right there. So that would go like right through C4. Depress the shoulders right there. So it kind of mentioned about the mastoid tip. The mastoid tip is like right there. Basically, kind of on this one too. I mean, really, you're getting her spine. So I usually just kind of keep the centering kind of behind the ear. Get pretty close to the spine right there. So this is her left side. Right there. I really never call me on this one, really. If you want to do it a little side to side, you can. I would definitely leave it up and top to bottom. But go ahead and take a breath in. Pull it all the way out. Hold it out. Expose. You can breathe, you can relax.
Just a regular breath, not a deep. Doesn't matter.
Pull it all the way out, hold it.
Okay.
And then expose so your shoulders are down. That's lateral C spine. So the next one I'm going to do is on the back, the RPO, LPO. So on this one, this is one, I'm going to talk about this tomorrow in class, or I don't know if we have it tomorrow, but this is the one, people kind of do things. Sometimes you might see stuff done in clinicals and different. This is like the one that I swear everybody does it differently. This one is supposed to be done at 72 with a 15-degree cephalic angle. You will see it done at 72 without an angle. You'll see it done with 40 with an angle, and you'll see it done with 40 without an angle. I'm going to tell you why you should always do it at 72 with an angle, but that's what's in the marrows, that's what it's supposed to be, that's how the parts are in the body, that's what you used to do. I don't know how it got so, but so many people do this so differently. So this one, RPO, LPO, and this you always do both because you need to see both sides of the joint. So it's not like an either or, you just do one. If you're doing a 5DC spine, you're always going to do lateral, RPO, LPO, AP axial, and then gonfalade. So on this one, from the AP position, rotate the patient 45 degrees, arm by their sides, center to the spine, the midline of the IR holder. This one, we'll talk about that more in class, but you're looking at the intervertebral foramina and the pedicles farther from the IR. We'll get into that, what you're looking at in class. So this is going to be 15 to 20 degree cephalic angle, still centered at C4. This one, just suspend respiration, the breathing really is fine. It's just suspend. So other one we kind of did it, put the arms down. So 15 to 20, I always do 15. 15 to 20 is correct. Bring this down. So go ahead and put your back against the board for me. What I do on this is kind of the same thing that we did on the rib. I kind of come up to her, turn towards me real quick. Good. this is something that I got a conversation with Janice, and this is something that you hands-on detect, but what I have people do on this one, go ahead and turn your head that way for me. Yeah, good. This really kind of helps open up the joint space. Sometimes you might see techs do it, sometimes you not. Me and Janice both agree that this does help. It's what we do. Sometimes you might go ahead and face me. Sometimes you might see people just do like that. I would tell them turn it that way. That really just kind of helps open up those joints. So still at the level of C4. I'm gonna line this up. Again, I don't really palmate. Just keep it open. With 45-degree angle. Head turned. Go ahead and hold your breath. Expose. You can breathe. Go ahead and put your back up against the board. Same thing. Next one, I come over here. Okay. Go ahead and turn towards me real quick. Go ahead and turn your head that way. Bring it forward just a little bit. So still the same thing. I'm gonna come up just a hair.
That's the center ends based off of where Adam's apple is or would be.
Yeah, C4, yeah, right there. So, good. Head turned that way. Good. Move that just a hair so I'm gonna line this back up. Just get that out of the way of the shadow. Go ahead and hold your breath. Expose. You can breathe. Go ahead and put your back against the board and hold it. So those would be the obliques.
And you just use the left on both sides.
Mm-hmm.
Okay.
Yeah. So
Just marking the left side. Yeah.
I'm confused on that. Why do you use it both?
Because yours, her left side would still show up on there.
Okay.
You,
But the other one, the first one, it was a level, that was behind you.
Yeah. It's again on your spine, not like your soft tissue in your neck, but spine. The left not make sense?
I guess not.
Okay. So even if I'm like this,
Mm-hmm.
left marker right here, right marker right there, would still be right.
still
Like this,
in the light.
right marker right here, left marker right there,
Okay.
would still be right.
Okay.
I'm not big on like switching out markers and stuff. If I can use the same one all the time and not get it messed up, I haven't moved. I mean, I moved it just a little bit, but I haven't really moved it since I did my lateral.
Mm-hmm.
So instead of doing like some people might want you to do, when we turn right, we use the right mark. But this is still correct.
Okay.
Does that make sense? Go ahead and put your battery. I'm kind of coming. So y'all see, kind of get in that position again. So y'all see why I would still use the 72 for the oblique.
Mm-hmm.
This next one, AP axial, turn your back up against the board. What do you think I use for this one distance-wise?
40.
Yeah. So this one I come into 40. So already I'm at 72, I have my angle. So this one also has an angle, so it makes it really easy. I come into 40, and I still have my angle. You want to step out of the way for me real quick? I'm gonna get this back lined up.
On our test next week, on our comp, we're not gonna do all of these, right? We're
No,
gonna
it's
draw.
That was the only one we're gonna do that on was the chest and stuff. But
Okay.
we're gonna draw for the rest. Alright, so go ahead and put your back up against the board. I'll read this real quick. Place this patient supine or AP erect. Still the same thing, 15 to 20 degree cephalic angle, centered at C4. Says collimate to 1 inch on each side of the skin. So this one, same thing. Center C4, get her right in the middle there. Lower this down. You can collimate. I'm not gonna lie, you can really no collimate on spines, but go ahead and hold your breath. Expose. So there's your AP axial. Basically, we'll talk about this more in class, but basically kind of these holes and these openings, they sit in the body like this. So to really open them, that's why I do that 15-degree angle. Boop, it's gonna pop them open. So that's why I need to do a 15-degree angle and have that 72. So this one's gonna be a doozy, and I'm gonna talk about this.
I see it.
I was thinking about this last night. I was like, oh geez. Okay, this one's an open mouth one, so this is gonna be really hard to do. I'm gonna take this out of your comp box because it's just,
Okay.
we'll talk about it. It's just gonna be hard. You'll have mask on. I'm gonna go through it. Y'all can practice it, but it's just gonna be difficult. So this one is the open mouth one. I've kind of mentioned this before. It really gives a good, like you have your C1 and C2 comes like this. It kind of gives a good where it pivots right there. So this is a good, because people are like, why are you doing this one? You know, because it's weird to shoot through your mouth, but you're really still looking at the top of the spine.
You're just getting your teeth out of the way. Okay.
Yeah. So it says, patient supine or erect, center a perpendicular central ray to the midpoint of the open mouth, level C2. Have the patient open their mouth as wide as possible, adjust the head so that the line from the upper teeth to the mastoid tip is perpendicular to the IR. When you do the exposure, say ah. So ah to keep their mouth really open. So this one's kind of going to be a doozy. We talk about it in the book. I'm going to collimate. So I'm just really going to get her little mouth. So collimation is going to be pretty small. What I do for collimation though, I keep it wide enough for my marker though. So this line is what's really important. So basically her mastoid tip, behind your ear, you have this like little bump right there. The bottom of that bump right there, that's her mastoid tip. Go ahead and open your mouth for me, even though I can't really see your mouth. What I would do, tilt your head up just a little bit, down just a little bit. What I'm really imagining is this line going right here between, so you have your teeth, your top teeth, your bottom teeth, that line going right here to the bottom of the top teeth needs to be perpendicular to the board. If your head is too far back, the back of your head is going to be right over that C2. If your head's too far forward, your teeth are going to be right in front of that C2. This one is kind of a hard one to get. Like some people get like, not repeats, but have to redo them again. Or there's something, we don't do it in lab, we'll talk about it in class. It's called the Fuchs projection. If you can't get this, there's an alternate position, alternate that you can get.
Is that a very common procedure? This one that we're doing.
To do this?
Yeah.
Yes. If you do a 5-view C-spine, you're always going to do this.
No.
Depends on the hospital. If you did a 3-view, even if you did a 3-view, you would do the lateral AP and this one. So anytime you do a C-spine, you do the odontoid. The only thing, if you did a 5-view, you do the obliques.
What is it called again?
The odontoid, because that's what that's called. That C2 is called the odontoid.
What if they have dentures? Tell them to take
Take
it
them out.
out.
Yep. It's super easy to get if they have dentures and no teeth are in the way.
Right.
So y'all can practice this. It's kind of hard now,
Right.
but really just, and I'm not going to do this in a comp because even on this too, this is almost one I always want to shoot out. Because sometimes I could be like, yeah, your line looks perfect, and then we shoot it, and like your teeth are just in the way just a little bit. Because
Yeah.
I mean, really a dot of difference. Back of the head's on the odontoid, the head's forward, teeth are on the odontoid. So open your mouth real quick. There's the mastoid tip. If I follow that, that's going to be the bottom of her top teeth. If that's perpendicular, there's my marker. Go ahead and say ah, exposed. You're saying ah too to bring your tongue down, so your tongue's not in the way either. So that one's kind of a doozy with mask on and everything. I thought about last night. I was like, oh no. But we'll kind of just know the line, think about the line, practice the line and everything. We'll talk about it in class too, but this little bump right behind her ear, you follow that to so there's her top teeth, the bottom of her top of her teeth. That needs to be perpendicular to the image receptor. Have her say ah, exposed. So odontoid won't be in the drawing, so everything else will. Still kind of look at it, practice it, but